Good news in Colorado. Our numbers continue to decline a bit. We are nowhere near our Christmas or our Thanksgiving peak. Colorado's overall numbers are certainly better than they have been. If you look at our positivity rate, it's also taking a little bit of a dive, which is great. The overall numbers for how many tests are positive in Colorado also look a bit better this week. Our state is mostly still dark brown, but there are little light patches in there. So, again, we'll take it. And remember, this is incident rate. So how many overall cases per county. Hospitalizations also look great. We're definitely in a decline. And so there's lots of bed availability for those unfortunate souls who do become very sick with COVID. We have a lot more bed availability here in the state than we did in the past, which is a couple of weeks, which is reassuring. The death rate, certainly, that's a big peak, and it does lag several weeks behind cases. So the jury's still out on this one, for sure. Our local data, again, continues to mirror what happens in the state. So our overall numbers have also declined from our post-Thanksgiving peak. Our incident rate also is less than it was last week, which is great. Overall numbers, we still have a ton of COVID. If you look at our overall numbers, we're almost at 500 total cases since the pandemic began. Our census here in the hospital, we continue to take care of our local COVID patients who are not needing ICU stays. And so we continue to have good bed availability here as well and are taking care of our own. Our positivity rate still continues to be relatively high compared to the state, but certainly less than it was last week. So we continue to improve from that standpoint as well. We had 45 positive tests over the past 2 weeks. And honestly, most of those were from the week before. So hopefully next week's positivity rate will be even less. And then, of course, my favorite slide continues to be true. A couple things about our vaccine rollout I wanted to talk to folks. So as everyone is aware, we are doing the over 70 group. Thanks to all of you who have come in. We have done 381 vaccinations here in Lake County with medical professionals, first responders, and then the over 70 group. And so we're definitely headed in the right direction. A big shout out to St. Vincent Hospital. We and through Ariana, the clinic here, have been vaccinating the vast majority of over 70 folks. Rocky Mountain Family Practice is also participating. The public health department is doing specific groups. So for example, they did the ski patrollers at Ski Cooper yesterday, so they're doing more group work. But the vaccine rollout is here. So for those over 70, please make sure you contact your primary care provider, be scheduled to get your vaccine. We are very likely to finish the first round of vaccinations for our plus 70 crowd by the end of January, and then the second vaccination by the end of February. So having all of that high risk group vaccinated by the end of February, which is right on track with what the governor has outlined for us. So we're doing a great job. If you do not have a primary care provider here in Lake County, you will need to make sure that you contact one of us, either St. Vincent's Hospital or Rocky Mountain Family Practice. We will get you in. Your primary care provider in another county cannot vaccinate you because the vaccines are distributed per county, not per not per provider. And so if you live in Lake County, you have to have your vaccine here. There is a little controversy about second homeowners, and we're not honestly not sure what to do with those. And so for people who have homes here in Lake County, but have a permanent address elsewhere, the governor would like us to have them vaccinated where their permanent address is, because that's how the vaccines are allocated. We won't have enough here for second homeowners if their permanent address isn't here. There is a governor-based call on Friday, and maybe we'll learn a little bit more. But as you can imagine, a lot of the resort towns are having a similar issue, trying to figure out how to vaccinate folks who have second homes here. So more information there to come, but I do encourage all of you, please, who are 70 plus, come see us. We would love to put a shot in your arm.
Any questions for Dr. Lisa? I wasn't first in line, but I was in line. So
yes, it's great. Yeah, it is lovely seeing everyone walk through our halls and getting vaccinations. It is very satisfying for me personally to know that we are protecting those that we hold so dear to our hearts. And so thank you for coming. And obviously we'd like to continue to make that happen. One thing also, seeing Karen's face, that reminds me to bring up, the CDC did talk about changing the age to 65 instead of 70. And we had a press release from the governor last night who reiterated that, of course, we would all love to be able to do that, but we just don't have the vaccine supply to be able to do that. So in Colorado, we're still going to do the 70 plus group. And then, of course, as we get more vaccine, we'll continue to roll it out to other high risk groups, including that plus 65 group, and then those with medical conditions. But if everything goes as planned, and of course, there's, that Yiddish saying, right, that people plan and God laughs. But if everything goes to the way that we would hope that it would go, we get to start our next phase at the beginning of March, which is, phase 2, which is all the high-risk medical groups and people over 65. So stay tuned. We'll continue to bring that information to you as it becomes available.
anyone
Dr. Lisa,
go ahead. Go ahead, Pat.
This is Pat Klober. I just want to thank you for the organization that you put into all of your work and taking care of all of your patients. But it was really nice to see how you rolled everything out. And I believe the information is out there. I think there are some people, I can't believe it, but there are some people rather reticent about getting a vaccine.
Yeah, well, thank you for the kind words, Mrs. Klober. I appreciate that. All we can do is lead by example. All of those of us who have been vaccinated, we haven't turned into a frog.
That's right.
I still, I still have all of my parts. Nothing has fallen off. I think it's showing of the safety information, and people hopefully will listen to the data and respond accordingly. It is the end of the pandemic, folks, and the only way that we're going to get there is if we get vaccinated. And I am so ready for this to be over.
Thanks a lot.
Yes, ma'am.
All right. Thank you, Dr. Lisa, for your weekly update. Let's